a little light bulb went off. And so anyway, that was my path into starting my own practice. I came back. That was 20 years ago. I started A&E Audiology, and I have never looked back. It's been the most wonderful thing I've done professionally. We've helped over 20,000 people in Lancaster County and in other places around the world. So I'm going to tell you a little bit more about that. But first, I like to show off pictures of my family. And this is my wonderful husband, Michael. We've been married for 36 years. We have 2 sons. A&E stand for Andrew and Eric, and I consider them to be my greatest accomplishments. Here they are with their wives. They're both now grown up and married, and they're very appreciative that I named the practice after them because that drew them into working at the practice. My older son, Andrew, worked here for about 6 years, and now he works in cybersecurity in Virginia. And my younger son, Eric, is our managing director of the practice. So if you see a tall, handsome young man walking around the office, that's my son. Anyway, so one of the things when I was growing up in India, I was born in the US, but I went there when I was 5, and I grew up with my grandparents, and they were always very much about serving others. And that's been something that really resonated with me, and a thread that I've carried with me throughout my life. And so one of my favorite quotes is by Mahatma Gandhi, and that is, "The best way to find yourself is to lose yourself in the service of others." So when I started my practice, I wanted to do things a little bit differently. I wanted a new approach to hearing healthcare. And I just wanted to be able to serve people regardless of their financial situation. I just didn't want anybody to be prevented from enjoying their life, participating in their life because of an untreated hearing loss. And so what we've done over the last 20 years is, of course, we have patients who come in that are self-pay. We have some payment plans. We participate with some insurances. And then a couple years ago, with the help of my son, Eric, we started a nonprofit. And I'm going to tell you a little bit about that. It's called A&E Hearing Connection. And we also have done humanitarian outreach. So this was my very first patient 20 years ago when I was brand new and I had just opened the doors to my practice, and I was really nervous about, you know, whether anybody was even going to call. My phone rang, and it was this very wonderful gentleman. He was a truck driver, and he called in a big panic. He was at his physical, and he had to renew his license, and he found out that he had hearing loss and he wasn't able to drive unless he got hearing aids. And so he called in a panic, and I was able to get him right in and got him fit with it, rushed everything and got everything back for him within a couple days. And he was so grateful he could go back to work. And he's been a patient ever since. And, you know, this is what I love about our practice, is the relationships we build with our patients. And he still, he actually moved to Missouri, but he still calls us. We send him supplies for his hearing aids. He wants to drive out here when he needs something, because we just have this wonderful connection. And that is why I just love what we do here at our practice. So I mentioned we had started a nonprofit, A&E Hearing Connection. I'm very proud of this. We serve people through the nonprofit that cannot afford hearing health care. There are lots and lots of people around this local community in Lancaster that come into our office from time to time, and they, you know, it would break my heart when they were sitting across from me and I would diagnose a hearing loss, and then we talked about treatment. They would say, "Well, I'm sorry, but I just can't afford that." And so that was the genesis of A&E Hearing Connection. And through that, we have this beautiful circle of giving where we help the patient with hearing health care. We provide hearing aids at a reduced cost or a sliding fee scale. And then they pay for their hearing aids in part by doing community service. And we are most grateful to the community here because they've been extremely supportive of our nonprofit, and we're grateful that we've been able to help people. The other thing that I'm very passionate about, and I think this goes back to growing up in India, is just reaching people that live in places around the world in developing countries that just don't have access to hearing health care. And so I'm really grateful. Over the last 20 years, I've been able to go on 20 different mission trips. This map shows you some of the areas of the world where we're having an impact, places like Guatemala and the Dominican Republic. We've gone to the Middle East, we've gone to India, and one of my most favorite places on the planet is Zambia, Africa. So we bring teams of audiologists, equipment, we bring hearing aids that are donated by patients. They're hearing aids that we purchase also, and we provide the gift of hearing, and that's extremely rewarding and something that I'm very, very passionate about. Of course, because of the current situation with travel, we've been grounded for a while, and I'm just antsy and ready to get out there and be able to do more of this. Speaking of Zambia, these are a couple of patients that we were able to help, and the gentleman on the right side of the screen is Edward. He came to see us last year, the year before last, I'm sorry, and he came from a community that was several kilometers away. They use kilometers in Zambia. He rode his motorcycle and it broke down on the way, so he ended up having to walk for several hours to get to us. And he got there at the very end of the day. And we were able to fit him with some hearing instruments. We saw this most beautiful hearing smile. A hearing smile is when we fit somebody with hearing aids and they can hear again, or they can hear for the first time and their whole face lights up in a smile. And it's just one of the most beautiful things you'll ever get to experience. And Edward was able to hear, and he was so grateful. He wasn't able to go home that night, so one of the local villagers offered him a place to stay, and it was on the floor in their little hut. And Edward went to sleep. He put his hearing aids next to him on the floor, and when he woke up the next morning, a rodent had chewed through one of his hearing aids. And he was so disappointed, because here, after all these years, he finally was able to hear for just a few hours. So last year when we went back to Zambia, Edward came back to see us. There was a lot of tears and a lot of hugs, because we could do things like that, and we were able to get him back into some hearing aids. And it was just a really, really a great feeling to be able to help him, and many others like him. And then on the left side of your screen is a little girl by the name of Sylvia. And in the United States, 3 out of 1,000 babies are born with hearing loss every year. Not every year, but out of every 1,000 babies, 3 are born with hearing loss. And we have some good programs in place to help them, but in some areas we don't. And in areas like Zambia in particular, there's one audiologist to serve the whole country. So when a child is born with a disability, oftentimes the family don't know what to do with them. They just assume that it's an intelligence issue, and the child gets marginalized. They don't get access to education. It's just very heart-wrenching. And so we were able to identify this beautiful little girl at age 3, fit her with some beautiful pink hearing aids that were donated from a family here in Lancaster County. And she's doing wonderful. We keep in touch. She's now in a school. There's a teacher who's helping her learn sign language and learn how to talk. And so it's stories like these that really inspire me to keep, working on giving back in some capacity. And I think one thing that I'm so proud of with our practice is that we believe that we can do well by doing good. And so we obviously are able to serve our patients right here in Lancaster County, reach some of the people in the local community, and also have a greater impact elsewhere. So what do we want to talk about today? I can talk about our nonprofit and outreach for hours on end, but we're here today to talk a little bit about hearing loss and your brain. And so there are three key areas that I want to cover today. And the first one is, what are some of the symptoms and the impact of age-related hearing loss? And the second is, what is the association between hearing loss and cognitive health? And then last but not least, I'm going to talk about hearing loss treatment. What does that look like? Why is it important? What are some of the processes that you should be aware of? So hearing loss is a progressive and degenerative neurological disorder. It affects many, many people, and depending on the source, it's estimated that over 40 million Americans have some degree of hearing loss. And as many as 40% of people over age 65 have clinically significant hearing loss. And this prevalence increases with age. So when you're in your 70s, you're looking at 40 to 66% of people. And when you get into your 80s, more than 80% of people will have some degree of hearing loss. So it's extremely prevalent. Interestingly, it is one of the third most prevalent chronic conditions in older adults. So the first is hypertension, then high cholesterol, and the third most chronic condition, prevalent chronic condition in older adults is hearing loss. And this has important effects on physical and mental health. And despite this, it's interesting because very, very, very few family physicians, internists, medical doctors routinely address hearing. I have patients that come in here time and time again. They might be in their 50s, 60s, 70s, 80s, and they've never had a conversation with their physician about hearing loss. So if you're watching this and you're a physician, I encourage you to look at screening your patients. Just like you look at blood pressure, you look at cholesterol, start talking to your patients about their hearing. Just starting the conversation is the right step in the right direction. So what are some, and if you're a patient or a person watching this, then talk to your physician about your hearing when you go in for your routine physicals and ask them to check your hearing, send you somewhere to get your hearing checked if they're not able to do it in the office. It's interesting because we screen all newborns in the United States now at birth because we know how important hearing is, and we want to identify hearing loss by age 3 months and fit hearing aids by no later than 6 months. So we're really careful, but with adults, oftentimes hearing loss just goes untreated for years on end, and it causes all kinds of challenges. So what are some of the symptoms of hearing loss? Well, I want to talk about 4 main symptoms. There are others, but today we're going to focus on these. And the first one is loss of clarity. So it's very common for patients to come in and say, I think I hear, but I just don't understand. And we call that a loss of clarity. And that means that they're able to hear when somebody's talking, but it's not clear. They're not comprehending the message effectively. And this causes a lot of frustration for them. They feel that people are mumbling. There's emotions that run high. They ask people to repeat, what did you say? That causes a lot of frustration in their relationships. So that is a very common symptom of hearing loss, is a loss of clarity. The second one I'm going to talk about is difficulty hearing in background noise. And this is one of the most common, most pervasive challenges that people with hearing loss have. And that is being able to hear when there's some other noise present, because it seems to interfere with their ability to understand. So an example of this would be the television is on, your spouse is talking to you, and you can't hear clearly because the background sound is interfering. Or you go to a family gathering, like next week, we're all going to be gathering with our families, and people sit around the table with their family and they can't hear the conversation They're asking people to repeat, they're mishearing. So a common symptom of hearing loss. Another less understood symptom of hearing loss is called tinnitus or tinnitus. And that is like a buzzing or ringing sound in the ears or somewhere in the head. And this is present in about 80% of hearing losses. It's very, very, very common to have hearing loss, and tinnitus shows up as a symptom. Not 100% of the time, but 80% of the time. Most often, tinnitus can be annoying. It's something that people feel frustrated about. It can interfere with their ability to relax. I know I personally had an experience with tinnitus at one point in my life, and it was extremely distracting and distressing. But sometimes tinnitus becomes so problematic that people can't sleep, they can't relax, and I've even had patients who became suicidal because their tinnitus was so problematic for them. And the one thing that you want to know about tinnitus is if you have tinnitus, it is a very strong indication for hearing loss. You must get your hearing checked when you have tinnitus. It gives us a lot of information about the origin of tinnitus when we can look at your hearing profile. Again, this is an area that medical doctors are not as familiar with, and oftentimes patients are told, well, it's just something you have to learn to live with. And while many people are able to do that, there are some people, like I said, where that becomes a huge problem. So you always want to get a hearing test if you have tinnitus. And it's okay to call it tinnitus. Both are accepted by the American Tinnitus Association. Next thing is cognitive decline, and I have a lot of slides where I'm going to talk about that. So basically, we're going to move on to the next slide, and then I'm going to start talking more about cognitive decline. But first, I want to share with you just some very basic anatomy and physiology of the ear, because I love this stuff. Now, fortunately for you, I'm not going to spend a lot of time on this, although if you're interested, please call me and I'm happy to spend time reviewing this, because I think the anatomy and physiology of the ear is one of the most fascinating, complex systems in the human body. So you see a diagram of an ear here, and this is the pinna, the outside of the ear. There's the ear canal. Sound enters the ear. Inside the ear canal is the eardrum, and it vibrates the eardrum, and then it travels through the little bones of the middle ear. They're called, well, you might know them from middle school as the hammer, the hammer, the something. Oh, I'm forgetting, but it's the bones of the middle ear, and they hammer, anvil, and stirrup or something like that, I think is what they're called. But their malleus, incus, and stapes are the professional medical terms. And these little bones vibrate and present sound to the inner ear. This is the inner ear here. It is comprised of two parts. The one part, which is this coil-shaped organ, is called the cochlea, and this is the inner ear where you have the little hair cells that vibrate in response to sound. And then you have semicircular canals. You have 3 of them, and this comprises your balance system. So I'm not sure that a lot of people understand, but your inner ear helps you both with your hearing and your balance, and they're both completely interconnected. So oftentimes, if there's hearing challenges, people can also have balance challenges, and vice versa. So if you were to uncoil this little cochlea, you would look inside, and there are these little hair cells. And the next slide has a really nice depiction of the hair cells. But these little hair cells vibrate in response to sound, and they transform the signal into little neural messages that are conveyed via the auditory nerve to your brain. As I mentioned, this slide shows you what hair cells look like in our inner ear. there are nicely arranged, neat rows of hair cells, inner and outer hair cells. And this is an intact cochlea where the hair cells are beautifully arranged. They're able to pick up all sounds and encode these sounds for the brain. But on the right side here, or in the middle of your screen, is a damaged cochlea. And this might be a cochlea of a person who was exposed to a lot of noise, or who has had all different types of medications that have affected the hearing, or just the aging process. And as you can see, these hair cells are affected. This is kind of a depiction of one of these little rows here, what the hair cells should look like. And when they're exposed to toxic events, noise exposure, then this is what happens, and they lose their elasticity and they're not able to conduct sound to the brain. So hair cells in the inner ear are extremely important, and there is a lot of research that is being conducted right now in the military, outside the military, trying to find ways to regenerate these hair cells, just like they're working on regenerating hair on your head, which seems to sometimes become more scarce as we age. So hair cells are extremely important. They're the little sensory conductors of sound from the ear to the brain, and they present sound from the ear to the brain via the auditory nerve. Interestingly enough, people believe that they hear with their ears, which is in part true, but the heavy share of lifting is done by the brain. So we actually really do hear with our brain. And again, if you want to have a conversation about brain and hearing and anatomy and physiology, please, 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 I love doing that. Come to my office, call this office. I'm happy to do that. If you want me to do a presentation, I'm happy to do that as well. But when it comes to the brain, what it has to do is it has to accept the signal from the ears, and hopefully that's a clean, clear signal because you have intact hair cells and you have an intact auditory nerve. And then what the brain has to do is make sense out of it and comprehend it, which is the most important part of this process. So I'm going to just give you a very brief overview here. And what this slide shows you is that the brain has to help you orient to sound. So it helps you, figure out what direction is sound coming from. That's very important when you're in a group of people, to know which person to look at when they're speaking. It's also important for our safety. Where is that sound coming from? Is that an alarm? Where is that alarm? Is there something coming up behind me? Is that a car? Is that a bicycle? Do I need to get out of the way? It has to also separate and focus and recognize the sound. So it has to be able to understand when you're in a place where there's sound you want to hear and sound you don't want to hear. It has to help you separate those sounds, and then it has to help you focus on the right one. And then it also has to help you recognize and understand what that sound means. So your brain does a lot of heavy lifting when it comes to the hearing and understanding process. And I've been doing a lot of work lately in the area of auditory processing. And this is something where people's hearing system works fine, but when the sound gets to the brain, so in other words, when we test their hearing, their audiogram is normal, they have normal hearing, but when the sound gets to the brain, they're not able to make use of it effectively and efficiently, and causes a lot of frustration for them. So I'm going to talk now about hearing loss and cognitive decline. But in order for me to do that, I just want to make sure we're all on the same page about what is cognition. So cognition is a term that refers to the mental processes that are involved in gaining knowledge and comprehension or understanding. It includes things like thinking, knowing, remembering, judging, and problem solving. And these are higher level functions of the brain that also encompass language, imagination, perception, and planning. So that when I talk about cognition, I'm talking about how your brain uses information to think, to remember, to judge, and understand what's going on. So back in 2011, there is a gentleman at Johns Hopkins. His name is Frank Lin, and he's an otologist. He is extremely well educated, well respected gentleman. And he started looking at data that was from something called a Baltimore longitudinal study on aging. This is America's longest running study of human aging, and it looks at what happens to people as they get older. It started back in 1958, and there are more than 3,200 volunteers, so 3,200 volunteers that are a part of this study, and it's basically provided thousands of scientific papers and made major contributions to our understanding of what it means to get older, or what are factors that contribute to exceptional aging. And so Dr. Lin was looking at this information, and what he found, which was the most profound finding, was a strong association between untreated hearing loss and your risk of dementia. In fact, what he found was that your risk of dementia goes up 200 to 500% with untreated hearing loss. And what you see here on the screen is that even with a mild hearing loss, you are twice as likely to develop dementia as somebody with normal hearing. So this was a huge finding that spurred a lot of additional research, which I'm going to be sharing with you as we go on here this morning. And it was just really something that audiologists had been talking about for a long time, but there was no great evidence until this data was mined for this information. And then it became very clear that your hearing is so linked to your cognition. And it's not surprising, because if you think about it, they have so much in common, your hearing and your cognition. And so these are some characteristics that are shared by hearing loss and dementia. And I just want to show you how common it is. You know, it occurs more frequently in people older than 65. It comprises social engagement, causes trouble remembering information, comprises physical activity. Changes in mood and personality occur with both hearing loss and dementia. Increases in prevalence with advancing age, introduces difficulty in having a conversation, and causes withdrawal from work or social activities. So really, you know, there's a lot in common between your hearing and your cognition. And what Dr. Lin and some of the subsequent researchers have been able to show us is that treat your hearing loss, your brain works better. And I'm going to share some more slides with you shortly about that. So why do we think this happens? Well, one of the things that we know is that when there's a hearing loss, we have to work harder to listen. So we call that an increased cognitive effort. And what happens as we age is you see these connections between the ear and the brain. There's a reduction in those signals. And so now the brain has to just work harder. And what was so fascinating about this research that Dr. Lin highlighted was that there are actually physiologic changes that occur in your brain as a result of untreated hearing loss. And think about that. How many people have you known throughout your life that had some hearing loss? How many relatives, like a grandfather or a parent or somebody that had a hearing loss, and they just said, you know, I don't want to do anything about it. I don't want hearing aids. I'm just going to deal with this. Well, literally, when your brain is deprived of sound, there are changes that occur in the tissue of your brain, and the tissue of your brain shrinks. So the next two slides, I want to show you a brain with a normal brain, a brain with dementia, and then the next slide is a normal hearing brain and a brain with hearing loss. And note the similarities between the two of these, which was, again, highlighted by the research that Dr. Lin presented. So on the right side of your screen is a normal, healthy brain, and on the left side is a brain with dementia. It shrinks. There's a lot of deepening of the fissures in the brain and overall shrinkage of brain tissue. But the same thing happens with hearing loss, and this is a brain scan on the right side of the screen that looks at a brain with normal hearing, and on the left side of the brain, as you can see, that there's been a shrinkage and atrophy in the tissue. Cerebral atrophy is what we call this. And so not addressing a hearing loss causes physiologic changes in the brain. We also know this from studies with children, because if you have a child who is born deaf, if you treat the hearing loss, fit them with hearing aids early on, they develop speech and language very similar to a child with normal hearing, with a lot of extra help, of course, but the course of development is very similar and comparable to a child with normal hearing. But if you don't treat that hearing loss and you wait 2 years, 4 years, 6 years, then the brain changes and you're not able to see the same outcomes. The child will have a lot of problems with speech, a lot of problems with hearing, and consequently learning and communicating. So the same thing happens with children, and the same thing happens with adults. Other impact of untreated hearing loss includes, a problem that we're seeing now quite a bit with the pandemic, and that is social isolation. People humans are social animals, and we really, really need to be around other people in order to thrive. And when our hearing is affected and we have hearing loss, that causes a lot of social isolation, which is a huge, huge risk factor for cognitive decline. Hearing loss that's not treated causes depression. Patients will come in and say, I just feel, like I'm not myself. There's an emotional turmoil. It causes a lot of problems with their relationships. I have actually known people that have had to divorce because of hearing loss. Actually happened with a close friend of mine, and the husband in the relationship had untreated hearing loss, just refused to do anything about it, and it led to so many communication challenges and unfortunately breaking up of that relationship. Quality of life, and that's a big part of your hearing and your communication is when you can hear and connect with other people. It enhances your quality of life. If you're able to go out and enjoy yourself, people with hearing loss frequently withdraw from social situations. Again, mentioned earlier, we're coming up on the holidays. It's a beautiful time of year to be around family. Of course, this year is a little different from other years, but if you go to a family gathering and you're sitting there at the table and you don't hear clearly what's going on, that's very difficult, and it affects your quality of life. Another thing that people don't know, and this is related to what I talked about earlier with your balance system, is that you are at an increased risk of falls with an untreated hearing loss. So this is particularly important as we age, because as you know, falling in our later years can lead to a lot of challenges, breaking a hip and things that don't end well for the patient. So I guess the question is, all right, hopefully I've convinced you of the importance of your hearing and how it affects your brain and how it's linked to cognitive decline. The question is what to do about it. Well, it's pretty simple, and I don't think you're going to be surprised when I say treat your hearing loss. Treat your hearing loss just like you treat any other significant ailment in your body, like cancer or diabetes or blood pressure or cholesterol. Treat your hearing loss. Easier said than done, right? So of the 40+ million people that have hearing loss, unfortunately, family physicians don't screen for this. People avoid going to get their hearing checked. There's a lot of misinformation about hearing loss. And so that results in so many people that have untreated hearing loss. In fact, only 1 out of 5 people who need help with their hearing actually get help with their hearing. So there's a huge unmet need for hearing loss in this country. This is, information from the National Council on Aging when you treat your hearing loss. What they found is people who actually treat their hearing loss and wear hearing aids. Remember that I didn't talk about this earlier, but 90% of hearing losses are what we call nerve type hearing losses or sensory neural hearing losses. 10% of hearing losses are possibly treatable by medicine or surgery, but 90% of hearing losses are nerve type hearing losses, which are only able to be treated with hearing aids, amplification, other assistive devices. So people who embrace that and wear hearing aids report a huge improvement in their quality of life. They report a huge improvement in their relationships and their self-esteem. This is Dr. Eric Kandel, a Nobel Prize winner from 2000 in medicine. And he said, if you are over 50, have annual hearing evaluations and wear hearing aids if you have a hearing loss. How many of you over 50 have even had a hearing test? He said wearing hearing aids is like brain training. It keeps the auditory nerves exercised and it has an immediate positive impact. And we have so much research now that proves that this is correct. And he said this back in 2000. Here's a study that was done in 2016. And what they found is active hearing aid users actually increase their cognitive function. So within 2 weeks, there's an improvement in your cognitive function after we treat your hearing loss. And I've seen this with so many patients. They come in, we talk about solutions, we treat their hearing loss, and when they come back for a follow-up visit 2 weeks later, sometimes I don't even recognize them because their whole demeanor changes. They're brighter, they come in kind of closed posture, kind of sad, frustrated, family members are frustrated, they come back in and they're like a different person. And this is just within the first 2 weeks. Here's a study from 2015. This one was from France. And again, it was a longitudinal study with thousands of people that provided the data. And what they found is that active hearing aid use reduces your risk of mental decline. In fact, if you treat your hearing loss, you actually reduce your risk of dementia so that it's equal to somebody who has normal hearing. So pretty much you've eliminated that 200 to 500% more risk, and you're now on the level playing field with somebody who has normal hearing. Another study from Columbia University. This is Dr. Lahani. That's a kind of a mouthful. I suppose I'll get in trouble because it sounds like an Indian name to me. But anyway, somebody from Columbia University. Hearing aids can reduce the risk of developing dementia. Using a hearing aid may offer a simple yet important way to prevent or slow the development of dementia by keeping adults with hearing loss engaged in conversation and communication. Another study, 2018, hearing aids can postpone dementia for seniors. This study talked about people with hearing loss who wear hearing aids and how their risk of developing dementia becomes the same as those people without hearing loss, similar to a couple slides ago, eliminating the additional risk for developing dementia by treating hearing loss. The next slide is Dr. Doraiswamy from Duke University, and he talks about the difference between treating dementia with medication, treating dementia with addressing the hearing loss. And he said, the benefits of correcting hearing loss on cognition are twice as large as the benefit from any cognitive enhancing drug. So twice as effective as any medication on the market for dementia. He says it's the first thing we should focus on. And again, from my personal experience with patients, I have seen this time and time again. I've had people bring their older parent to see us, and they're wondering if maybe the parent is developing some dementia, and we do the hearing test, we identify the hearing loss, we treat the hearing loss, and they say, I can't believe it, I have my mom back. I can't believe what a difference this is making. So it should be the first thing that we focus on. This is information from the Lancet Commission. It's basically it's a weekly peer-reviewed general medical journal. It's the world's oldest and best known medical journal, founded in 1823 in the UK, and it's called the Lancet. And with this, the finding after looking at multiple studies on aging and dementia and risk factors for dementia, they narrowed it down to two things that you can do that are most effective in reducing your risk of developing dementia. The top two things you can do out of a number of risk factors are, if you have peripheral hearing loss, treat your hearing loss, and avoid social isolation, which is strongly linked to your hearing because, again, when you are not able to hear, you're less likely to engage. So next slide is from the Journal of the American Medical Association, their patient page. These are things you can do to reduce your risk of dementia, and there's highlighted correct your hearing loss. You can look this up on their page as well. So, there's no cure for dementia, but there definitely are some significant arguments for looking at hearing and treating that if there is somebody in your family that you're thinking of, or a friend, or you yourself are concerned about your memory, your cognitive abilities, get your hearing checked. This is so important. The gap between the need for treatment for hearing loss and what's actually happening, because there's a lot of negative stigma around treating your hearing loss. And, in general, the average amount of time that people wait to treat their hearing loss is 7 years. And I've seen people who have waited 20 years or more to treat a hearing loss. And what's interesting is after we treat the hearing loss, they've waited 20, 25 years, they'll come in and say, gosh, I wish I would have done this sooner. This is amazing. Now I can hear. Now I can participate in conversations. So we have a lot of work to do. I'm going to keep going here. I see that it's 10:47. Usually at this point, we may pause and see if there are some questions, but I'm going to go ahead and finish up here. I might jump over a few slides here because we're running out of time, but I do encourage you to check out our website. It's aehearing.org, aehearing.org. I encourage you to check us out on Facebook. We share hearing smile stories on Facebook. We share information about our local nonprofit, about our patients at our practice, about some of our humanitarian trips. We have some beautiful videos. I do warn you, you might need a tissue for watching some of them. And so anyway, I'm going to talk a little bit about treatment here and then round this up here by the end of the hour. So the treatment process is quite complicated. It involves a thorough diagnosis, then it involves customization of the plan for each patient. There are really important components that need to be addressed to make sure that we identify exactly where the difficulties and deficits are, and then we design a custom treatment plan so that we address the cognitive aspects of your hearing loss. And this is, again, where a gap exists because there are a lot of different hearing aids out there. There is a lot of misinformation about hearing aids out there. People sometimes think of hearing loss as a retail situation where you go buy a hearing aid, stick it in your ears, and everything is solved. But it's really not like that. We use a medical model in our practice where we use doctors of audiology who do a proper and thorough diagnosis. And we help to sort through all the different types of hearing aids that are out there. Just because your uncle got a hearing aid that worked for them doesn't mean that same one's going to work for you. Or if your brother has hearing loss and they bought something that works for them, it doesn't mean it's going to work for you. You want to make sure your doctor of audiology is looking at your hearing profile and customizing things, especially for your ear, and addressing the cognitive aspects of your hearing loss. Studies show this is really important. Here's a study that talks about the quality of the devices and how important that is. Technology's improved dramatically since I first got into this field. And when I first, finished my master's program, before I even got my doctorate, we were fitting hearing aids that were analog, using a little screwdriver to adjust potentiometers. And now things are wireless. We can connect with Bluetooth to your phone, and we can customize things beautifully for each patient's need, make it as simple and hassle-free as we need to. We can provide you with connections to your phone and Bluetooth, as I mentioned, and with children, we can even help with access to speech in the classroom. This is a fascinating device. Again, we don't have a lot of time to talk about it. It's called a Lyric. It's a extended wear device that lives about 4 millimeters from your eardrum and your ear canal. It's very deep in your ear canal. You can't see it. I have a little short video here of what it looks like to insert it. I'm going to skip that because you can go to our website and see the video. And once it's in the ear canal, you can see that it's completely invisible. And people really like it because it's so hassle-free and easy, and you can sleep with it, you can shower with it. Every 2 to 4 months you come back in and we replace it with a new one. So it's a really, really great hearing system that works well for patients. It's very popular. We're the only practice in South Central Pennsylvania. We do have patients that drive from a couple hours away because this is so effective for them. If you want to find out more about that, please do call the office. I'm going to put the slide up here with our information at the end, and you can go to our website, aehearing.org, and I'm sorry, you can go to our website, havebetterhearing.com. aehearing.org is our nonprofit. You can go there as well. Good stories there. You can call the office. You can text us. I'll put that up in just a minute. One last thing I want to just highlight really quickly is, related to the current pandemic and quarantining and wearing masks. What patients are finding when they have hearing loss is it's extremely difficult to communicate with a mask on, and that's causing huge challenges. People's voices are muffled. Often people with hearing loss rely on lip reading, and that's a problem. People are losing their hearing aids when they take their mask off. We've had an increase in the number of people who are losing their devices. And social distancing is a problem because, with hearing loss, sometimes you have to be up close. You need visual cues. So, there are some things we can do. We have clear masks that go across your face and they're clear and you can see the person's lips. So if you have a loved one who needs that, you can call our office and purchase those. Wearing a face shield, as long as you're also using some form of a mask that's clear. And there are some other solutions we have. So if you're interested, please check us out and we'll happily give that information to you. So just to wrap it up, thank you for being here today. I hope this was informative for you. I'm happy to come out to your organization and do this again. We can do webinars. We can do, we're doing another session in a month or so at a retirement community. I was just at the Lions Club. I love talking about hearing and hearing loss and the importance of your hearing. It is a progressive degenerative disorder. Please don't ignore it. Talk to your family doctor. I explained some of the symptoms of hearing loss, like your loss in clarity, background noise, hearing problems and background noise, difficulty with tinnitus, and cognitive decline. Treat your hearing loss early. Don't put it off. People sometimes say, well, they cost so much, and we don't have a lot of time to talk about that today. But when you come into our office, we will make sure that we pick a treatment plan that fits your needs and your budget. So we have a lot of good options for you. Treating your hearing loss is really one of the best investments you can make in your long-term health and your quality of life as you get older. So thank you so much. Here's the information I said I would share. There's our email, info@havebetterhearing.org. You can text us, you can call us, and certainly go to our website, havebetterhearing.com. It was such a pleasure to be here with you today. I hope you enjoyed this as much as I did, and we'll see you again hopefully soon. Take care, stay healthy, stay safe.